Days 3 to 4 after trabeculectomy, calming inflammation while staying mobile. If you had trabeculectomy surgery for glaucoma, your body is now in the early healing phase. It's common at this stage, around days 3 to 4, for your eye to be red and swollen and for your sight to be blurry or fluctuating. Don't worry, this is usually normal. The eye's natural response to surgery is to be a bit inflamed at first. Most patients still have some redness or a bloodshot look in the operated eye during the first 1 to 4 weeks. Likewise, your vision may still be far from perfect. You might notice it going in and out of sharpness. One moment your sight seems nearly normal, the next it feels quite hazy. This happens as pressure and fluid levels in the eye adjust and as stitches and swelling settle. Typically, blurred vision after trabeculectomy starts to improve after a week or two and returns to its best over a few months. In short, expect ups and downs in comfort and clarity at this stage, but no need to be alarmed if each day brings a little better vision. To help calm inflammation, your surgeon will have prescribed anti-inflammatory eye drops. These are usually steroid drops, for example, dexamethasone, and sometimes a non-steroidal anti-inflammatory acetate drop. In the first days after surgery, you'll likely use them very frequently. For instance, one clinic's protocol is to put in steroid drops every 1 to 2 hours while awake for the first few days, then gradually taper to a few times per day over the next weeks. Another guide recommends continuing steroid drops every 2 hours during the day for about the first month, then slowly reducing the dose over 2 to 3 months. It's vital to follow your exact drop schedule. These anti-inflammatory drops and the prescribed antibiotic drops prevent infection and control swelling so your new drainage bleb can form properly. Don't stop them early and try not to miss doses. Always wash your hands before touching your eye and close your eye for a minute after each drop so it can soak in. Activity and precautions. While you should avoid strenuous activity or stress on the eye, it's also good to stay as mobile as you safely can. In general, doctors advise moderate rest, but not complete bed rest. You can sit up, walk around indoors, and do light tasks. For the first 1 to 2 weeks, however, be sure to avoid heavy lifting, bending, or anything strenuous. For example, avoid lifting anything heavier than about 10 pounds, a small bag of groceries, and refrain from jogging, weightlifting, or intense housework. Bending forward, for example, to tie shoes or pick something from the floor, can temporarily raise eye pressure. To protect the eye, plan tasks ahead to minimize stooping. A reach or grabber tool can help pick up items without bending. If climbing a ladder or heavy lifting is part of a chore, wait until your doctor says it's safe. According to guidelines, even ordinary housekeeping, dusting, vacuuming, cleaning, should be gentle or postponed for about a week or two. These chores can stir up dust or require bending, straining, which could irritate the healing eye. Avoid dusty or smoky environments whenever possible. Airborne particles or smoke can irritate your eye's surface or introduce germs. Health systems often advise using indoors air filters or masks if you must be in dusty areas. Also, don't rub or press on the eye. Even if it feels irritated, keep that reflex in check. Wear the prescribed eye shield at night, typically 1 week or as directed, to prevent accidental rubbing while asleep. If your eyes feel light-sensitive outdoors, use UV-blocking sunglasses or wraparound shades, preferably with side shields, to protect against wind, dust, and bright light. One often overlooked step in recovery is preventing constipation. Straining on the toilet can significantly raise eye pressure, which you want to avoid while the eye heals. Therefore, your doctor may recommend a high-fiber diet or a gentle stool softener. Keep your bowels easy moving. For instance, consider fiber supplements or stool softener tablets each evening, but only if your doctor okays it. Drinking plenty of water also helps with this and supports healing overall. There are many mobile apps today to remind you to drink water regularly, which can be a handy tool during recovery. Warning signs. When to call your doctor. While some redness and discomfort are expected, watch closely for any worsening symptoms. Alert your doctor immediately if you experience any of the following. Severe or increasing eye pain that doesn't get better with your usual pain relievers. Some soreness is normal, but sharp or throbbing pain is not. A pus-like purulent discharge. Thick yellow or green fluid coming from the eye is a red flag for infection. A rapid drop or change in vision beyond mild blurring. If your vision suddenly gets much worse, or you see a new dark or shadow area, call urgently. Halos or colored rings around lights, especially accompanied by a headache or eye pain. These can signal a dangerous rise in eye pressure, similar to an acute glaucoma attack. If your eye also becomes very red or brownish, that is another warning sign. Worsening redness or swelling that doesn't start to improve after a few days. Persistent redness or a swollen eyelid might mean inflammation is not subsiding as expected. Any signs of infection elsewhere, fever, chills, or feeling generally unwell. If you see any of these, it's better to err on the side of caution. Many hospitals stress that infection and severe pressure problems can cause permanent vision loss if not treated promptly. Don't wait. Contact your eye surgeon or go to the emergency room if needed. Practical tips for comfort and safety. Eye shield or patch. Continue using an eye shield at night as directed. This prevents accidental rubbing. Some people keep a plastic shield taped over the eye at bedtime for the first few nights. Pain management. Take over-the-counter acetaminophen, Tylenol, every 4 to 6 hours as needed for discomfort. Do not use aspirin or ibuprofen unless your doctor approves, since these can increase bleeding risk. Stool softeners, fiber. As noted, take any recommended fiber supplement or stool softener to make bowel movements easy. Hydration. Sip water throughout the day. Good hydration helps your body heal and keeps the eye moist. Setting reminders on your phone can help you drink regularly. Light activity. Short walks around the house are fine. You can read, watch TV, or do hobbies like knitting or light crafts, anything that doesn't involve bending or heavy effort. Use caution if walking outside. Wear your sunglasses. Reacher grabber tools. Use a reaching tool for tasks that would otherwise require bending, like picking things off the floor or reaching low shelves. This avoids pressure spikes from bending. Eye drop organizer or app. If you have a complicated drop schedule, use a pillbox-style drop organizer or a phone app. There are eye drop reminder apps to track each dose. This helps ensure you don't miss anti-inflammatory or antibiotic drops. Above all, follow your surgeon's instructions. Attend all follow-up visits, often scheduled weekly at first, so the doctor can monitor your bleb, the filtering area, and eye pressure. They may adjust stitches or medications in the early weeks to keep your pressure in the safe range. Recovery can be a bit unpredictable, but staying on top of drops and restrictions will help everything settle down. Conclusion. By days 3 to 4 after trabeculectomy, you should be gently resuming normal life while still taking good care of your eye. Some redness, mild soreness, and blurred vision are normal. Use your anti-inflammatory eye drops exactly as prescribed to calm swelling. Keep strenuous activities on hold, protect the eye from irritants, dust, smoke, bumps, and prevent any straining in daily tasks. Be mindful of any warning signs, worsening pain, pus, halos, and report them immediately. With these precautions, along with simple aids like stool softeners, sunglasses, hydration reminders, and reachers, you can support a smooth recovery and protect your vision. Always ask your surgeon or nurse if you have questions. Good communication and safe habits are key to getting back to full strength. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.